Kia ora everyone, I'm here with Dr. Gray and we're here to answer some of your questions about ADHD assessments at TEND. So can you tell me about them?
Yeah, so a lot of people might be aware that the rules around ADHD assessments changed on the 1st of February this year, which means that in the future getting an ADHD assessment if you're an adult is something that you may be able to do through your GP.
So if I'm an adult and I think I may have ADHD, how do I get an assessment with a GP at TEND?
ADHD's assessment is kind of complicated, so it's not something that can be done just in a standard 15-minute GP appointment. And so what we're doing at TEND is setting up a program, an ADHD assessment program. Previously, if you wanted to be assessed for adult ADHD, you had to do that through a psychiatrist, which was really expensive and also really difficult to access. So most psychiatrists have a wait of, many months before you can even get in. So we're hoping to solve that for patients, but it's still going to be a pretty structured kind of program. So you'll need to book in specifically for this assessment, and it's going to take some time still. So this is something that in total will probably take up to a couple of hours. Then the GP who has a special interest in ADHD will be able to make an assessment of whether or not you do have ADHD and whether or not medication is the right thing for you.
Okay, so will this service be available across all TEND clinics?
We're not quite sure yet is
Okay.
the answer. Yeah, this is something that's going to need to be done by GPs who have some special training and a special interest in ADHD. And so right now we're going through the process of putting those GPs through some training and also working with psychologists and so on around the assessment program. So there's still a little bit of a wait before we launch this. It's probably going to be a couple of months, but then once we do, you'll be able to select that as a service through the TEND app and book in for an ADHD assessment.
Is this open to casual patients or enrolled patients or everyone?
This will be available to everyone, so if you're a casual patient, you'll be able to undertake this assessment as well.
Can someone access this assessment online? So if they live in a remote area of New Zealand and they need this kind of assessment, can they access this?
Yep, so you will be able to go through this process online, although there are some exceptions to that. If you do end up being assessed that it's appropriate for you to go onto stimulant medication like methylphenidate or something like that, you will still need a physical examination and a blood pressure and, depending on your other medical issues, or if you have any other medical issues, you may still be required to come in for a physical assessment. But most of it will be able to be done online.
So the cost of these assessments, is it going to be different to a normal GP consultation here at TEND?
Yeah, it will be, because the amount of time involved won't be the same as a standard GP appointment. It's probably going to take a couple of hours, so we haven't settled on an exact price just yet. It will be priced according to the amount of time that is involved.
So will anybody be able to get a GP assessment for ADHD?
It depends is the answer. So, if you have like a complicated medical history or a past mental health history, for example, and it's not a straightforward ADHD diagnosis, then it may not be possible for a GP to do that for you, and you may end up needing to be referred to a psychiatrist. But for people who are, otherwise healthy, a straightforward ADHD diagnosis, then yes. But I guess there will always be some people who may need referral for specialist care.
So for everyone who's interested in accessing ADHD assessments through TEND, we do have a waitlist that you can join. You can click the link in bio, or we'll put the link below here for you to put your name and email down, and we'll let you know as soon as our service is launched so you can access this service.